Dr. Boateng, now let's bring it down to individual responsibilities. Um, what are the most common mistakes people make when it comes to malaria prevention and treatment? Yeah.
Thank you so much, Prince. There are quite a number of mistakes that we make when it comes to malaria prevention and treatment. Maybe one key one, I think that has been highlighted a number of times already since we started, is the non-use of the bed nets. People take the net and then use them for other things besides sleeping under them, and that means that you are putting yourself and your entire family at risk of getting malaria. And we always forget malaria can be very deadly. I keep reminding people that malaria can actually affect basically all the major organs in your body. And therefore, let's not look down on malaria. Let's ensure that we use the bed nets and use it appropriately, basically making sure that we are sleeping under them every night and throughout the night. And it's only through that we'll have the full protection from the bed net. In fact, it's been found one of the most impactful malaria interventions so far. So let's not lose sight of that. Let's use them, sleep under them, and then also sleep under them every night, and then also throughout the night. That's the only time we get full protection from these bed nets. The other mistake that people also make is that they assume that once they're using one preventive intervention, then that should be enough. But that is not true. I mentioned that it's always helpful to use multiple preventive interventions, and by so doing, we increase our level of protection. I've also come across people who, for some reason, believe that even when they are bitten by mosquitoes, they don't get malaria. I've seen people who think that their blood type or blood group or whatever doesn't make them get malaria, so they don't do much to protect themselves from mosquito bites. But that is a misconception. All of us in Ghana, in fact Africa, largely are at risk of getting malaria. It is important that we protect ourselves as such. Now, the other mistake I've come across that people make is not testing for malaria before treating. And as they assume that every fever or high body temperature is caused by malaria, and therefore move away to take anti-malarials without first testing to be sure that it's malaria. Now, if you do that, first of all, you are wasting the medication because you're not treating malaria. And what you're also doing is that you could be putting the anti-malarials at risk of the parasite developing resistance to them. And then, of course, you won't be treating the particular cause of the fever. And therefore, if you don't take it, by the time you realize the fever is due to probably meningitis, it's probably a bit too late in the day for you to be saved. And so you'll be missing out on your actual diagnosis because you just assumed that the fever was due to malaria. So we encourage people to make sure that test and only take the anti-malaria when you test positive. Now, there are those also, of course, they will test and they will test positive, and they'll start the treatment but not complete the treatment, especially after day 1 or day 2. Once they realize they are fine, they stop taking the medications. And this is also not good at all, because malaria, the parasites can survive and probably come back harder and give you a more severe malaria. There are also people who also don't report to the health facility early or start treatment early. And if you don't do that, the later you start treatment, the more likely that you are likely to develop the severest form of malaria. Okay, so the admonition is that within a day of having a fever or any sign and symptom of malaria, seek care and start treatment within 24 hours, and that improves your chances of recovery. Okay. There are also some who are also resorting to non-effective treatments, particularly herbal medications, and assume that they are safer, and also assuming that all herbal medications are effective, but that is not so. Herbal medications that are effective against malaria are those that have been approved by the FDA and also recommended by the Ministry of Health for malaria treatment. And therefore, if you choose to use herbals, make sure that you are getting it from the right and appropriate source. There are also those who do not verify the medicines that they buy. Even if they are buying the orthodox ACTs or artemisinin-based combination therapies, do not take any effort to check the labeling, to check the packaging, to check whether really does this medicine look genuine or not. And so if you take medicines that are counterfeit, your malaria is unlikely to resolve. And so we admonish persons to make sure that at least have a little quick look and make sure that the medicine that you are purchasing, first of all, hasn't expired and also doesn't have any suspicious features that may make you suspect that this may be a counterfeit medicine. So these are some of the few things I probably would highlight for now, that mistakes that people make when it comes to malaria prevention and treatment as well. Thank you.
Okay, Doc. So if you follow up questions, you know, some people complain about the heat when they sleep in the net. Is there any advice you can give them? And also about the testing for malaria. I know some people, when no matter what, they always get negative, but then when they take the malaria drugs, they get better. Is there any advice for them too? And also, lastly, some pharmacists, I don't know how I should put this, but those who do the walk-ins to the pharmacies and they just prescribe any medicine to people without even testing them. If you can also touch on that one too for us.
Okay, thank you so much for those questions. I'll start from the third and then I'll move up to the first. So in terms of the pharmacists who are not testing, one common complaint I've heard is that one, some of them are bent on just selling the antimalarials, whether or not, and so they are not so much focused on the testing. Two, some people have complained that sometimes patients don't have money, so they have to choose between doing a test. If the test is positive, you don't have any medicine to give the patient, or not doing the testing at all and giving the patient an antimalarial. We had a webinar just about 2 or so days ago, and I think patients are becoming more aware of the fact that they need to test before they treat. And now, because the patients are becoming more enlightened, they will choose pharmacies that are offering quality care and treatment, and not only giving treatment just because they want to make some profit. And I think that pharmacists should be able to focus on providing quality care rather than focusing on just profit. And I think that with this, we've had a number of trainings and we continue to have trainings. We continue to visit some of these pharmacies and over-the-counter medicine shops just to make sure that we are building their knowledge and improving the attitudes when it comes to testing before treatment. And also the Pharmacy Council has been making efforts to make sure that pharmacists across the country comply with this testing before treatment protocol. In fact, that's the right way to go, and so we are continuing to make efforts to make sure that we all work according to that. Now, those who test negative and take the anti-malarial, and because they got better, assume that it was anti-malarial that made them better. I would say, of course, that is not right. And I always cite the case of COVID-19 as an example. When COVID-19 came, what did people take? People took all kinds of medicines. People inhaled all kinds of things. But we know that the natural progression for majority, over 90% of people, is that because it's a viral infection, it is self-limiting. And therefore, within a few days, whether or not you took any medication, your body will self-recover. So now the question comes, is it the neem tree that people were taking or the things that people were healing? Were those the things that were making them better? No. It was because that was the natural cause of the illness. Within a few days, you would get better. And in fact, when it comes to the infective causes of fever in this part of the world, majority of them are due to viral illnesses. And just like COVID-19, most of these viral illnesses will resolve by themselves, whether or not we take any treatment. And so I just continue to admonish that let's adhere to the test, treat, and track policy, and only treat those that test positive with antimalarials. Because you may risk missing out on another diagnosis, and that diagnosis, when found out later, will be too late for you to save yourself or save your patient. So once the test result is negative, let's look out for the other possible causes of the patient's condition, and let's treat that as quickly as possible so that you don't get into a much worse state than they came in. The point I'm making is that the fact that they got better by taking the antimalarials does not mean that it's the antimalarials that made them better. Most likely they would have recovered by themselves anyway. When it comes to those who sleep under the insecticide-treated nets and they say it makes them feel hot, or because of the heat within the room or within the environment, it makes them feel hotter and therefore they are not able to sleep at night. I think that there are ways to go around this. So mostly people complain about that with the hard nets, and therefore we are making efforts to make sure that we get more soft nets to distribute around, so that one is a bit more friendly when it comes to the experiencing of heat compared to the hard nets. We also advise that there are also other ways by which we can cope with the heat. We put on the fan if you have the fan. There are others who would sleep outside but also use the nets. You make sure that it's well tucked under the bed outside the house, just to make sure that they don't feel the heat too much. So these are some ways by which we can go around the heat that people experience when they use the nets. In fact, it probably may be a bit, I would say that it would be better to face a little inconvenience and protect your family rather than, because of some little inconvenience, you face a greater risk of malaria and severe malaria and death when it comes to your family. So we continue to advocate and admonish us to just make sure that we adhere to these protocols and find ways of reducing the heat that may be associated with a particular kind of nets that we may be using. Thank you.
Thank you, Doc. So, Doc, just to be clear on the negative, when you test negative, no need for you to go ahead with treatment, right?
Yes. So the advice is that if you test negative, there's no need for you to go ahead with the treatment. If your clinician or you yourself doubt the test results, what we advise is that you can repeat a different type of malaria test, or you can go back and retest the following day.
Okay.
But never treat a patient who comes with the mild form of malaria, like the uncomplicated malaria. When they test negative, never treat them with antimalarials. No, we never advise that. Always look out for the other possible causes of the patient's condition and treat. I've had several experiences of this.
Yeah.
For instance, there are people who have fever, chills, headache. A friend of mine experienced that and did every kind of test. It was okay, and felt he still had to take antimalarials, only for us to realize in the next few days that it was chickenpox. It was just the initial phase of chickenpox that he had.
Yeah.
In fact, there are experiences of, I think it was in 2016 or so, in the then Borno Ahafo region, when we experienced more like for the first time meningitis outbreak within that part of of the country. I mean, previously it was more within the northern part. And a lot of the clinicians were treating these patients for malaria and missed out on the meningitis diagnosis, only for us to have an outbreak later. And so, based on some of these experiences, even in my personal life, there was a time that I realized that later that it was due to stress and it wasn't due to malaria.
Yeah.
I mean, I wasn't well. I did all tests, it was negative. I said, okay, let me take anti-malaria. I took anti-malaria, I didn't get better. I took typhoid medicine, I didn't get better. In fact, when on the third day of the typhoid medicine, it even got worse. My condition got worse. So I just said, okay, let me stop all these medications, just rest, take enough fluids. And basically, it was just stress that was making me feel that way. And since then, I'm not taking anti-malarials whenever I test negative for malaria. So there are so many other causes of fever that we shouldn't be just limited to malaria as the cause of fever, because there are no signs and symptoms that are very typical for malaria. All the signs and symptoms are just like any other health condition. Like typhoid will give you basically the same kind of signs and symptoms, and many other health conditions will give you basically similar signs and symptoms. So you can't use the signs and symptoms to say that, oh, this is a malarial illness. No, you'll be missing it. It is a test result that will differentiate between and differentiate to tell you that, okay, this is malaria and this is not malaria. So I'd advise that we trust the test results that we have and go according to.
Everybody come around and join